I don't want to talk to an agent. Why don't I just talk to somebody that is a volunteer somewhere and they don't get paid a commission to present a product, and because they know everything that I need to know? Well, we're going to look at that in just a minute. I'll tell you about an encounter I had. It was on a friendly one, but an encounter I had on a public forum where, well, we'll get into it in more detail. Hi, this is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. Yeah, every once in a while I run into folks. Sometimes, people will call me up, or somebody who is looking to go on Medicare, looking for information, and they'll tell me that, well, they've talked to the people, a SHIP counselor, State Health Insurance Plan, I think is what that stands for. These are volunteers who work for an organization that explains to you about how Medicare works. Be careful about that. A lot of these people know how Medicare works, but they don't understand the insurance side of it. I ran into that this morning. I participate in a fair number of public forums, and I do it not necessarily anonymously, but I do it in such a way that I'm not there soliciting business. And that's not only the professional way to approach it, but most of these forums, if you're blatantly soliciting business, they'll just ban you. So why even go down that road? But anyway, I was on a forum this morning, and somebody was asking about, it's somebody poses a question, other people chime in and they give answers and so forth. And sometimes the answers are partially true. Sometimes they're way off base. But in any event, somebody was asking about Medicare covering Shingrix, Shingrix. Shingrix, that's the shingles vaccination, and it's a fairly new one, and it's supposed to be like 96% effective. And they're asking about, well, why doesn't my drug plan cover Shingrix? Well, there's a lot of reasons to that. The Shingrix is covered under Medicare Part D, as in dog, but it's not covered by all plans. And the Shingrix vaccination is about $150 retail price, which coincidentally is what a lot of people end up paying if they run their Shingrix through a drug plan. Now, your doctor will administer, in some cases, your doctor may administer the Shingrix vaccination in the office, but they don't stock the Shingrix vaccination. You have to go get the medication, take it to the doctor's office, and it's a 2-dose situation. You take 1 dose now, and you come back in 2 or 3 months for your second dose, your booster shot, so to speak. So that's 2 trips to the doctor, if your doctor will administer the shingles vaccine. Most people just end up going to a drugstore to get it. You can also go to an urgent care facility and get it. But it's still going to cost you, no matter which route you take, it's still going to cost you about $150 to maybe $200, depending on where you are. If you're in an urgent care center, there's probably going to be a $30 or $40 or maybe a $50 copay to actually administer the drug. So you're looking at $150, $200 basically out of pocket. Well, all right, let's get back to the situation on the forum. One person said, and there had been several replies. This was a thread that was started, I don't know, about 3 months ago about Shingrix. And one person went on there and said, boy, there's a lot of misinformation and wrong answers on here. And they proceeded to, I don't know, they wrote a 6 or 8 paragraph post about, how the Shingrix vaccination is covered and how much it cost and all this kind of stuff. And I just kind of read through that and I thought, well, yeah, you're certainly right. There's a lot of bad and misinformation here, and you haven't made things any better. So as tactfully as I could, I posted a response and tagged that particular individual and said, yeah, you're right. There is a lot of misinformation here in this particular thread. And let's start with, and I went down a list, about 3 or 4 things that this person had said that were not true. Well, they took exception to that. Of course they would, and they came back and they said, well, I've been in healthcare administration for over 30 years, and I think I know what I'm doing, and I know the difference between a deductible and a coinsurance, and I'm not sure that you do. Well, she didn't know who she's talking to. So, and she then proceeded to tell about how her husband has a drug plan with Humana that has a $450 deductible, and their drugs, his drugs, are not covered until he satisfies the deductible. Well, now this is a situation that flies all over me sometimes, because the logical response to that is, if the drugs are not covered, how do you satisfy the deductible? And most of the time people don't understand the question, so I'll go ahead and repeat it. If the prescription drug is not covered, then how do you satisfy the deductible? Because if the drug is not covered, that means that it's not covered by the plan, and you will never satisfy the deductible by taking those drugs. That may seem a little bit confusing, but I want you to think about that for a moment, see if you can follow this. There's a difference in saying that a drug or a particular procedure is not covered, as opposed to it is covered, but the insurance company is not going to pay anything until you have satisfied your deductible. And even that statement does not apply in most cases when you're talking about Medicare Part D, as in dog. And the reason why I say that that part, that doesn't count if you're talking about Medicare Part D, if you have a Part D drug plan, and I've got a whole video on this because there's a bunch of agents out there that don't understand it, not to mention the people who are on Medicare and trying to figure out how their drug plan works. Let me give you an example. Let's say that you have a drug plan that has a $450 deductible. In most cases, the deductible only applies to Tier 3 and higher drugs. Tier 1, Tier 2 drugs are generally low-cost generics. So if you have Tier 1, Tier 2 drugs, and you use a preferred pharmacy, the deductible does not apply to those drugs. So you may have a small copay of $1 or $2 or $3. You may not have any copay. So the drugs are covered, and the insurance carrier, your drug plan carrier, is paying something towards the cost of those drugs. So to say that they're not covered is an error. So, but well, even when you get into Tier 3 and higher drugs, where the deductible does apply, the retail cost of that drug might be, pick a number out of the air, $250. That's the retail price. But you may only pay $125. Again, picking a number out of the air. But you may only pay $125 until you have satisfied your deductible, which is going to take you about 4 months to do that, 3 or 4 months to do that if you have a $450 deductible. After you've satisfied the deductible, that $125 copay drops down to maybe $25, $30. So to say that the drugs are not covered by your drug plan if you have a deductible until you have paid out of pocket. This is what most people think. Until you have paid out of pocket $450. I've even heard people refer to it as an upfront fee or an initiation fee or entrance fee. I've got to pay $450 before I ever get to my copays. That is not true. Again, I've got a whole nother video on the way Medicare Part D deductibles work. I suggest you look at it. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. Take care. Have a great day.